Now, it is National Nurses Day today, and today, instead of celebrating, nurses in Utica are protesting. 65 nurses were recently subject to layoffs at St. Elizabeth Medical Center in Utica. Nurses, elected officials, and community members are rallying to oppose these staffing cuts. Nurses say they were already short-staffed, and they say these cuts pose a big risk to patient safety and public health. The public was also invited today, and organizers asked those who are in attendance to practice social distancing and wear proper PPE. Organizers of the rally say the MVHS staff cuts run a serious risk of the hospital not being prepared to meet patient needs. They say MVHS could have and should have found other ways to cut their losses other than doing it through staffing.
I'm a per diem nurse at St. Elizabeth, which means I work when they need me. Starting this week, I have been called every day to work. That doesn't happen with per diem staff very often. So if they have a need for nurses, which they clearly do because they're calling me, why are we laying off nurses?
But I would like to reassure the community that we have a really great relationship with our nurses and all of our frontline worker and all of our staff. And it is unfortunate that NISNA leadership and a few people make the noise and make it seem like a different story than what goes on here every day.
According to hospital officials, the layoffs affected 65 nurses, and when you subtract those who applied for vacant positions and bumped those with less seniority, 40 wound up being laid off.